Thank you everyone for joining us tonight. My name is Sarah. I'm with Mi Mentor. I'm the Chief of Pre-PA Programming, and I'm excited to be here tonight. We have a couple of amazing PAs that I've had the privilege of knowing for a little over a year now. Done some projects with them, and it was only fair to bring them on board because I find them to be very inspirational, as well as just they have a wealth of advice to offer that nobody should be missing out on. So here we are tonight. A few of us are going to go through some of these slides. Then we'll get to the presentation. We have some announcements, and hopefully you can continue returning to Mi Mentor for more. We are a committee that are putting together what we think is essential information. All of us are pre-PAs ourselves. And so let's get started. Again, tonight we're presenting Lili Barajas and Sato Ikeda. And if I can have the next slide, please. In Mi Mentor, we're a 501c3 organization, meaning we're a nonprofit organization, which entails a lot of data collection in order for funding to trickle our way so we can offer certain things like in-person conferences, pay for Zoom links and things like that. But more than anything, to give you what you need. But we won't know that until you share with us what it is you need. So all of you who enroll through APLOS should have received a link or the QR code to our pre-event survey. It has some basic questions. It won't take more than like 3 minutes. We will also announce a post-event survey. We want to gauge what it is you need, if you feel like you got it, and if not, if you could give us feedback on that. So we'll bring that up. And the next slide, I believe, is being taken up by...
Yeah. Hello, everyone. My name is Tabitha, and I am one of the pre-PA SoCal ambassadors. As Sara started to mention, Mi Mentor strives to develop and support mentorship programs that aim to empower the next generation of healthcare leaders. We hope to foster diversity and inclusion within the medical field by providing mentorship to the historically underrepresented minorities in medicine to not only create spaces that are more representative of the patient population, but to also better equip future healthcare leaders to serve underrepresented populations. Next slide, please. Yeah, so as a pre-PA programming initiative, some of our goals include supporting your pre-PA trajectory, but also mentoring the historically underrepresented in medicine. So some of the active ways we're doing that is today, so hosting events that help you choose PA programs that give you insight into the process, what different fields they could take, and then also on future ones with personal statement workshops where you can get help on the personal statements for CASPA. Next slide, please. Thank you. Yeah, thank you. And lastly, the pre-PA network committee consists of current pre-PA students. So we all come from different walks of life. Some of us apply in the future, some of us are applying now or waiting to hear from schools, but our main goal is to provide community and a support system for the pre-PA community. We organize events that will enrich pre-PA students at different stages of their journey. Next slide.
Thank you, Tabitha. Hi, everyone. My name is Danae Martin. I am the external pre-PA president, and I'm really excited to introduce our guest speakers for today. But before I do so, please, we would like to remind everyone to hold on to your questions. You can put them on the chat. And if towards the end of both presentations, if you want to unmute yourself and project your presentation verbally, you can do so, but we'll have a specific slide for that. And with that being said, so today we have two amazing guest speakers, Lili Barajas and Sato Ikeda. And I just wanted to go over what each one of them do. So Lili Barajas, she's a certified PA who graduated from Bay Path University. And in Massachusetts, she's a first-generation Mexican-American college student and a medical provider. She loves helping her community and inspiring other minorities to pursue their dreams, no matter how scary they may seem. And Sato Ikeda, he's a certified PA who received his undergraduate degree from UCLA. He completed his PA program at Duke University. Prior to matriculating into his PA program, he was a 6-time applicant, and he currently works as an ERPA. He has used his experience to provide words of encouragement to other pre-PA students. With that being said, we'll first start off with Lili.
Perfect. I'm going to go ahead and share my screen. Can everybody hear me? Okay, awesome. Okay, can you all see my screen as well? Awesome. Okay. So yeah, my name is Lili. I'm currently a PA practicing in emergency medicine, urgent care, and pediatrics. So I graduated from Bay Path University PA program, which is in Western Massachusetts, a small rural town. And I graduated in 2021. And I also graduated from Cal Poly Pomona with my degree in biology in 2015. So a little background of myself. I was born and raised in LA. I am a first generation Mexican American student. And I'm also the first in my family to go to medicine. So here you can see my older brother on the left, and then you see my little brother on the right. We actually graduated in the same year. Unfortunately, it was COVID year, so we graduated right in the peak of the pandemic. So neither of us had an in-person graduation, which was really unfortunate and honestly very sad for me. But I did have a white coat ceremony because that was before COVID happened. So my mom and my dad were actually able to fly out to Massachusetts, which they had never been to before. And honestly, just kind of having them there, it was like an amazing experience. You know, they were so happy. We all cried. I felt their support even if I was all the way across the country. So that to me was super important, because PA school is hard and, hard on everybody around you. So it was important for me to have a good basis and a good foundation with my family, knowing that I was going to be all the way across the country. So this is just a quick review of my timeline into getting into PA school. As I mentioned, I was first in my family to pursue a career in medicine. So I really had no idea kind of where to start. I started off as pre-med, but sometime after graduation from Cal Poly, that ended up actually changing into pre-PA. So about 2 years after I graduated from Cal Poly, I applied to CASP on my first try. And I would say that was kind of more of like a trial run. There's a lot of components to the application, as you guys will notice, that it's a little bit hard to manage when you don't really have advice for anybody. So I didn't get any interviews that time. And then I applied again in 2018. We got one interview and we got one acceptance. So I started PA school in May of 2019, and then we graduated in 2021. I took my pants like immediately after graduation, like 2 weeks. And then I moved back to California and started my first official job in pediatrics in October 2021. And since then, I've started at urgent care with Sato and in the emergency room as well. So just quick little background of my undergrad and kind of what it looked like. So I didn't have like super impressive hours. I wasn't like, having my GPA at a 4.0. So, it just kind of goes to show that anybody can do it. You just kind of have to take the leap and take the chance. After graduation, these are kind of the things that I was doing in order to kind of, make myself a more well-rounded and competitive applicant. I was working at a biotech company for the full 3 years that I was, my gap years. But I was also trying to get my clinical experience. So I was volunteering at the Venice Family Clinic as a Spanish interpreter and MA. And then I also completed the clinical care extender program at the hospital that I actually work at now. So full circle for you right there. And then I also took an extra 2 upper level division science courses. And then I shadowed 3 PAs and 1 MD. I think 2 of those shadowing opportunities I actually got through Mi Mentor. So, this is kind of a great place to network for sure. Just a quick summary of my statistics. So my GPA was a 3.5. I had about 1,000 hours of healthcare experience, 40 hours of shadowing. And then I was a 2-time applicant. So the first time I applied to 12 schools and I didn't get any interview invites at all. I got one interview wait list. And then 2018, I kind of narrowed down my schools a little bit better. And I applied to 2 schools actually out of state, which was Bay Path, the school that I ended up going to, and I think another school in Nevada. So I got the one interview and I got the one acceptance. This is just a quick little overview of, what PA school kind of looked like. So my school program had module-based learning. So we had learnings that, were based on systems. So cardiology, pulmonology, dermatology, ears, nose, and throat, GI. That was all kind of broken up into its own categories. So it was a 24-month program. So the first semester we had anatomy and physiology. And that was actually, so that was like a fake semester. That was like our little boot camp. So that was like our summer course. And then the fall and the spring is when we started doing the clinical medicine. But our little boot camp was so that we would relearn anatomy and physiology and also the patient assessment portion of it. And then these are all the clinical rotations I completed. Like I said, I did go to school like peak of COVID. So unfortunately, we did lose out on 2 rotations. So I lost out on my elective rotation and my break rotation, which our school implements. This is just me, what my current like work schedule kind of looks like. So I'm working per diem right now at pediatrics, urgent care, and the emergency room. In the emergency room, I would say that's kind of the job that takes up the most of my time. It's the newest job, so I want to dedicate kind of the majority of my time to that, especially because it's such a big learning curve. So I'm doing 6 to 8 shifts per month there. And then at the urgent care, I usually do like 3 to 4. And in pediatrics, I usually do 4 as well. And then I just wanted to kind of highlight a little bit on my class. So we had actually a very small class size. We had about 30, 32 students in my class, but also going, to school in a small rural community in Western Massachusetts. The biggest thing that I noticed was the lack of diversity. So if you guys look at the picture, you guys can kind of pick and choose how many people of color there are. So there was me and one other Latina girl in the class. And then there were 2 African-American students. And then I think there was 1 student from like the Middle East and then 1 from India. Everyone else was white, as you can see. So that was like a very big shock to me. I grew up in LA, so, we see so much diversity here. So going to a community where it was, predominantly not people of color was something that really stood out to me. But one thing that we also tried to implement in that program was because of that, and like during all the stuff that happened with George Floyd, we actually created a group called Be the Change. And it's actually a really awesome group. We were like able to make some changes to the interview questions. So now there's like questions about cultural sensitivity in the interview questions. And that was really awesome because, I feel like it makes people have like more well-rounded answers. But yeah, just wanted to share that. And then this is just a little bit of my experience living in the East Coast. I definitely, if you can afford it, I know everybody is scared about the amount of debt you're going to be in, but you're going to be in debt either way. It doesn't really matter where you go to school. But I really enjoyed my time in the East Coast. I was able to see the different seasons. So like I had never seen the snow before moving to the East Coast. And then the changes of the leaves, and it's just so much more greenery. And I was able to like explore like the entire like New England state. So going up to like Maine and Vermont, New Hampshire, all of those things are like in a super close, like 2-hour drive. It's not like California where it takes you like 6 hours to get out of California. But yeah, that was a really great experience. And that is all for me.
Did you take the GRE by any chance?
We'll actually take questions after we finish with the second speaker, if that's okay with folks. Was it, we'll go on to Sato's presentation then. And please, you can look for Alicia Hernandez. She's our monitor for questions tonight.
Cool. All right. My name's Sato. I'm an emergency medicine urgent care PA, and I work with Lili. Sorry, my dog's here with me, so you might hear her cry a little bit. But I work with Lili in urgent care, and I also work in emergency medicine on the side as well. A little bit about me. I was born in Japan. I moved to Virginia Beach, Virginia when I was 4 months old. I moved to Ireland when I was 6. I stayed there for pretty much all of elementary school until I came back to San Diego from the ages of 10 to end of high school. I came to college up in LA at UCLA. I stayed there until 2018, moved to North Carolina for 2 years for PA school. And then immediately after PA school, I came straight back to LA again. I graduated in the class of 2011 from UCLA with a bachelor's of science in psychobiology. I graduated from Duke in 2020. I was a 6-time applicant, as you heard before, and my pre-PA experiences have been I was a medical assistant in primary sports medicine, while simultaneously working as an emergency room scribe. And then 6 years later, I quit both jobs and I became ER tech, or an emergency room EMT. So my journey to becoming a PA, I applied every year from 2012 to 2017. I applied to 29 different programs, of which 28 of those declined or rejected my application. I actually counted. I submitted 69 total applications over the 6 cycles. Oh, that bothers me. Sorry, I spelled applications wrong. I apologize. But I applied 69 different applications over the 6 cycles. I actually have every single program that rejected me written down somewhere, because I keep track of things like that, because I have a chip on my shoulder from all that. My stats aren't great, as you can see. I graduated from UCLA with 2.67 GPA. I was on academic probation 3 times while I was there. I had multiple meetings with my counselors because they wanted to kick me out of the school because I wasn't maintaining their standards. But I turned everything around when I decided I wanted to go the PA route. I maintained a 3.8 post-bac GPA, and my overall GPA became a 3.03 by the time I was accepted. I had 16,000 hours of work experience, and I had 500 plus hours of shadowing, but that was mainly through my connections in the emergency department. I had 3 separate interviews. My first one came in 2016 at USC. I was waitlisted and then rejected. I had 2 interviews in 2017, USC and Duke. I was waitlisted at both. And eventually I got into Duke 3 weeks before the program started, but I also had 1 more interview invite for Texas Tech. But I ended up declining that because they wouldn't accept my quarter units from UCLA, and every UC program other than UC Berkeley is on the quarter system, so they wouldn't accept that. So they wanted me to take an extra class. And then I couldn't afford the plane ticket or the stay out there. And so I eventually declined that. My work life as a pre-PA. So like I said, I was a medical assistant in primary care and an ER scribe. So my medical assistant days, I worked Monday, Wednesday, Thursday. And then my ER scribe days were usually Tuesday, Friday, Saturday, Sunday. So if you notice, I worked every single day from Monday to Sunday, essentially. I worked about 28, 29 days a month because back then we got paid, I believe, $7.25 an hour, I think it was. My MA job was slightly better at $8, I believe. And so there were occasional overnight shifts where I'd work my morning job from 8 to 5. Then I'd go home and sleep for about 3 hours, then commute out like an hour away to go work an overnight shift in the ER from 10 to 6 in the morning. Then I'd drive home, which would take another hour, sleep for about 45 minutes, and then go to my regular day job again. As an ER tech, it was slightly better. I guess I worked about 12 to 13 days every pay period. So that's every 2 weeks. There were 12-hour shifts. So I worked about 144 to 156 hours every 2 weeks. Just to put that in perspective, about a regular full-time job is 160 hours a month. So that's how I got 16,000 hours, is because I was working about 300 hours every single month for 6 years straight. What I gained from my work experience. So the biggest thing I got from being a 6-time applicant was my work experience. I learned the ins and outs of the healthcare system. Definitely working in primary care taught me a lot about insurance companies, the various subspecialties that were out there, what kind of conditions they were treating, what was required for us to be able to refer our patients out over to them. I also learned a lot about other healthcare professions, such as physical therapy, dietitian, registered dietitian, PA, NP, podiatry, other things like that. Definitely seeing a lot of medical conditions was great, especially in the ER. I worked in a low socioeconomic area in the ER, and so you got to see a lot of things that you probably wouldn't get to see in most wealthier ERs, I guess. There's conditions like pheochromocytoma, Ludwig's angina, bacterial meningitis, things like that I got to see firsthand and witness firsthand that I have never seen in PA school or since then. And so that was a very good experience for me. As an EMT or ER tech, I got to do hands-on compressions, which is drastically different from doing on the mannequins, because it's a real human being that you're essentially compressing or attempting to compress their heart, while oftentimes simultaneously breaking their ribs. So you feel the ribs cracking under your hands, which is something that you don't want to feel, but unfortunately it's a reality of having to try to save someone else's life. And so that was definitely a huge eye-opening experience for me. Learning the various medications, and as an MA in primary care, as some of you probably know, you run through their medications list, so you have an opportunity to learn about the different medications, what their indications are, what their contraindications are. You learn all these medications, so you have a general idea of what they are and what they're used for before you go to PA school. So it's extremely helpful, because now you don't have to study as hard for pharmacology, which is, I think, one of the subjects that a lot of people struggle with the most. As a ER tech and as a MA, I also performed a lot of EKGs. Just out of curiosity, I wanted to learn how to read EKGs, so I had bought in the EKG book that pretty much every school uses, called a Dubin's book. Some of you probably have seen it before. It's like an orange book that kind of looks like a child's coloring book. So it has lots of pictures and colors and stuff like that. And it's really helpful. But that definitely helped me, learn the basics of EKGs and interpreting EKGs, which was definitely helpful in the cardiology unit, because that was a pretty brief part of our curriculum. And so I feel like I wasn't fully prepared to read EKGs until well after PA school. Most importantly, though, it's every small detail that you can learn before PA school is one less thing you have to study during PA school. And so, a lot of times we have a study guide packet that's 100 pages front and back at like 9-size font, single spaced. And that's what you have to study for an exam that you have, and you might have 2, 3, 4 exams in 1 week. And so if you can memorize, even 10-15% of that, it'll be a whole lot easier for you to succeed in didactics than it would be if you didn't. Whoever's moving the mouse, do you mind not moving? It's distracting. Sorry. Cool, sweet, thanks. Then the next slide, please. Cool. The hardest part about being a 6-time applicant, definitely the self-doubt. That was probably the number one thing that I found. It was, wondering if anyone ever see me more than just a 3-digit number. That was the 2.67. There were definitely some schools that wouldn't even look at your application if your undergrad GPA was below a 3. There's programs that won't look at your application if it's not, above a 3.3, 3.4, somewhere like that. And so, that was one of the things I struggled with the most, is that, I am so much more as an applicant than a 3-digit number. And so I struggled with the thought that, most people wouldn't even bother reading my personal statement. I wouldn't see what else my work experience had been, just because I didn't do as well as some other people did in undergrad. Wondering if the medical field was the right place for me. That was definitely something harder too, because I felt like, all the people I knew that went into medicine, all my friends that were, physicians and MD-DO program candidates, they were all some of the brightest people I knew. And comparing myself to them, I knew that, I definitely didn't work as hard. I definitely didn't put the time or effort into studying as much as they did. And so, there was plenty of times when I thought maybe, I should go do something else other than medicine. And so that was kind of a daily struggle for me as well. But at the end of the day, you know that other people are getting in at the same time. So I would often compare myself to these people, wondering like, what is it that other people had that I didn't have, other than just a GPA? Was there something else that they did that I didn't do? Was it extracurricular activities? Was it their work experience? What is it that made them succeed when I had failed so many times? I was basically comparing myself day in and day out with people that I trained. I trained countless of, PAs, nursing students, medical students that have all gone on to become PAs, nurses, and doctors now. And so that was very hard for me to be able to train someone and do, teach them how to do what I do, have them do it to somewhat of a lesser degree, and then see them succeed in doing what I wanted to do in the end. And so I'd often see myself getting jealous, just wondering, had I done a little better in undergrad, I would have been in their shoes, and I would have been in medical school or a PA school a long time before. The what if-isms, what if I chose to attend class? I mentioned that my GPA was a 2.67. The main reason why my GPA was a 2.67 wasn't because I studied really hard and I couldn't succeed and do well in tests. It was because I didn't attend class. I would skip exams, I'd skip midterms, I'd study the night before for finals. I found the life of hanging out with my friends, partying, drinking a lot more fun than attending classes. And so there were plenty of days where my friends were waking up going to class, and I'd be just coming home from a night out drinking, only to wake up sometime in the afternoon to go play basketball and then repeat my whole nightly activities all over again. Definitely thought about what if no school ever accepts me and I end up working a 9-to-5 job. That was probably one of the hardest things that I had to face. So how I overcame the hurdles, first and foremost, I believe that my parents have sacrificed too much for me to fail at becoming a PA. Like I said, I was born in Japan. I am an immigrant here. Neither of my parents have ever gone to college in the States. My mom did do an associate's degree, and my dad did have a bachelor's degree, but both of them were from Japan. Although you saw me, staying in LA and staying in California for pretty much most of my adult life, my dad moved about 6 or 7 more times afterwards. And so I hadn't lived with my dad since probably middle school, because he continued to move from location to location because of his job. And my parents chose to let us stay in Southern California so we could go to college, get a degree, and try to live our life, the way they wanted us to live it, and pursue our dreams. And so had I followed my dad through Japan, Singapore, Charlotte, Dallas, all these other places, the chances of me succeeding and becoming, being able to work in medicine were pretty much slim to none. And so I didn't want to waste the sacrifice that they made for me. And so that was definitely a struggle, something that hit me hard, but also something that motivated me to work harder and not give up on my dreams. I didn't want to spend the rest of my life thinking, what if I applied one more time? There was definitely plenty of times where I was just like, I want to give up. No one's ever going to see me for more than, a sub 3 GPA. No one's ever going to accept me for who I am. They're just going to see, some person that slacked off in undergrad that almost got, kicked out of school. And that's all they're going to see me for. No one's going to give me a chance. So why bother keep applying? And what every single time I thought that, it was always the thought of, had I applied one more time, maybe I would have been a PA. I didn't want to end up working a 9-to-5 desk job. Not that there's anything wrong with 9-to-5 desk jobs, but I knew it wasn't for me. And so I knew that I didn't want to be 40, 45 years old, working a Monday through Friday job, thinking, well, what happened if I applied one more time? Maybe someone would have given me a chance, and maybe I wouldn't be sitting here right now doing what I do, and I could have done something that I wanted to do, which was practice medicine. I put all my eggs in one basket. I knew that this is what I wanted to do. This is the only thing I wanted to do. I didn't want to do anything else. And so I would continue to improve my application, which was by improving my GPA and trying to figure out, what it is that I could do, how I could bolster my GPA even more. How could I make myself more competitive? How could I prepare myself even better for PA school? And so I just dedicated pretty much my entire life to becoming a PA. And I definitely relied heavily on my friends, and at the time, my girlfriend, on my wife, to support me during my many periods of self-doubt. Just my last words of advice. If GPA is your weakest aspect on your application, take more classes to raise your GPA. Definitely don't overextend yourself. Take only the number of classes that you can handle, because if your GPA is your weakest point, you need to get all A's. Nothing lower than an A is going to help you. A B is just going to drag your GPA down. A B plus may, keep it the same, but the more classes you take, the harder it is to raise your GPA. So if you take one class and it's an A, great. I'd rather have people take 1-2 classes and maintain A's than try to take 4 classes and get B minuses, B's in all of them, because then you're going to end up hurting yourself in the long run. Don't apply to schools just because they have a low GPA requirement. I learned this the hard way. I went through pretty much all my schools. Of the 28 schools, I think there was like 6 or 7 of them that had low GPA requirements that were like a 2.75 or something like that. And then turns out, when I reached out to them, they actually don't accept anyone that doesn't have a 3.3 or higher. And so they're just in there taking money away from students that are hopeful, and at a certain point desperate, trying to get into school. And all they're doing is making you pay $50 for a CASPA application and somewhere between $50 and $100 for a supplemental application, knowing full well that you have absolutely no chance of ever getting into their program. And so my word of advice for that is to research the incoming class stats, find out what their matriculating class stats are. And if oddly enough, their incoming class has a GPA range of 3.3 to 3.8 or 3.9 or something like that, they're obviously not accepting people that have a 2.75. So I wouldn't waste my money applying to them. And I think we as PAs and practicing PAs need to do a better job of calling these institutions out, because it's not fair for you guys to be suckered into, applying to all these programs when I know very well that you're not going to get in. They know very well that you're not going to get in, and you just hope that you can get in when in reality you probably won't get in. And then the last thing is, a lot of times I hear people want to pursue PA as a profession because you heard that it's a better work-life balance. Sure, that may be true in certain circumstances. I don't think it's true in every circumstance. I don't think the profession itself determines whether or not you have an adequate work-life balance or not. It's the job that you take in the field. It's what you allow your employers to do with your work schedule. I only work 16 days a month, but in those 16 days, I work about 180, 90 hours in that month, while my MD/DO friends work about 12 shifts, 14 shifts a month. They probably do about 120 to 150 hours, and they probably make about 75 to 80% more than I do. And so, don't think that just because you became a PA, you're going to have a very easy lifestyle and all that. Really research what it is that you want to do. If PA is truly what you want to do, then by all means go for it. But don't think that just because you become a PA, you're going to have an easy, 9-to-5 job without a bunch of paperwork and all the other stuff that comes with it. That's it.
Thank you so much, Lili and Sato. Next, we have questions. So first question is specifically for Lili. What helped to get over the emotional toll that rejections brought during your first CASPA cycle?
Oh God, it feels like such a long time ago. Honestly, I was like, okay, it was like my trial run. I didn't really know what I was doing. You know, I had better, I guess, strategies for the next cycle. So I kind of knew what I needed to improve on, and I knew where my weaknesses lied in the application. You know, I didn't have a lot of healthcare experience, and two, my transcript got lost on its way to CASPA. So it never made it to actually get verified in time for like half of the due dates. So like if your application doesn't get verified, like you're just automatically rejected, even though you paid your money. So it's like, okay, well, that was the first thing that I needed to do, like transcripts, letters of rec, like all the easy stuff that you can get out the way.
Thank you. Our next question is from Asia. She's asking, did you guys take the GRE?
Yeah, I took the GRE. I believe kind of like the general rule of thumb is you want to get like a 305 or higher on it. I got a 319. They don't really, I don't think they really weigh it that heavily because it's not really pertinent to our profession itself. It's just that when you get a master's degree from an institution, a lot of institutions are required to have it as part of their application process. And so you'll unfortunately have to take the GRE sometimes.
Yeah, same. I took the GRE, but I think my second round of applications, I ended up applying to schools that didn't require it because I didn't want to retake it.
Thank you. Our next question is for Lili. The question is, do you think we as pre-PAs can change anything now in the PA profession?
Definitely diversity. I feel like where like minorities lack, or not lack, I don't think that's the word, but I think where they need to just kind of apply. I think there's like a study out there that like minorities don't actually apply. So it's like, how do we expect to change this number in medicine if we're not actually like submitting any applications? So like stop being afraid of like the rejection and just like do it, because you never know who might give you a chance.
Thank you. Our next question is from Jasenia. She's asking, how did you transition from volunteer to MA at VFC?
I think they allowed me to do like be an MA without having like an MA certification, but it was because I became like good friends with like one of the directors of the volunteer. So she like trained me, and then I was able to work.
Thank you, Lili. Next question is, why did you pick to apply to the school you went to? And do you think applying to schools that need more diversity helps your chances when applying?
That's a good question. I don't necessarily know that that was something that they were looking for, you know, like, oh, she's Latina, let's get her in for an interview. Um, the reason that I applied to that school in specific was because they had I think a 500-hour requirement for healthcare experience. So I was narrowing down the schools that had like a lower healthcare experience. And then, like Sato said, looking at the people who actually matriculated and seeing how much healthcare experience they had, and knowing that I was like within that range. So I would be like still a good applicant for that school.
I only applied to Duke because my friend told me to apply to Duke. I actually had no intention of applying there because they were according to the US News, the top program in the nation. And someone that's been rejected 5 consecutive years probably shouldn't be applying to the top program in the nation, because if the lowest program in the nation doesn't want you, then I don't think the top program in the nation is going to want you. And that was my mentality going into it. She basically just told me that, like, well, if you apply, I'll pay for it. And so I said, okay. And that's the reason why I applied to Duke. There wasn't anything special to it. Luckily enough, that was the only program I got into. So I guess it was a blessing in disguise. In terms of, do you think applying to schools that need more diversity will help? I think it may help if the program itself wants to be more diverse. There's plenty of programs out there that have little to no intention of wanting to be diverse. We found this out, you know, during the pandemic with the whole George Floyd incident that happened, and when we were doing a lot more diversity and inclusion, this is a conversation that happened in a lot of Zoom meetings amongst PA students from various different programs. And so there's definitely schools that are looking to be more diverse. There's schools that don't really care for diversity very much, and I think that's reflected in the class, the demographics of the class. And so often programs that are proud of their diversity will post that on their website, and programs that aren't will kind of just post a picture of the class, and you can tell which programs care about diversity and which ones don't.
Thank you both. Our next question is from Richard. He's asking, how is your experience in plastic surgery? What was your scope of practice compared to the MD you work alongside?
I don't think I can give a really good answer to this because I had a terrible experience, hence me leaving in 3 months. In short, I was basically the MA, so I was like basically the medical assistant. I was taking the phone calls, I was booking appointments, I was grabbing the ice for the Botox. I wasn't doing any of the scrub-ins, even though, we were promised to learn how to do injectables and how to, be first assistant surgery. So, yeah, not a good experience.
Thank you for your honest answer. Our next question is for Sato. You mentioned finding work through connections. How did you begin building those connections? Many pre-PAs have a hard time finding shadowing hours, so how do we network?
I guess for work purposes wise, it's basically whoever you work for or whoever you work with, whether it's one of the MDs, DOs, PAs, MP nurses, whoever it is, fellow medical assistants, anyone else. I think the most important thing is maintaining a good relationship with all these people, because at the end of the day, you don't know where people will go. And so, if you maintain a really good relationship with someone, then you never know, when you graduate PA school, you might, they might have a job before you, and you might be able to ask them for a recommendation or a letter of rec, and you might be able to land a job with them. I got my urgent care job by reaching out to someone else, and then Lili got working with us by reaching out to me and the same person that I reached out to begin with. And so letter of recommendations and knowing people and connections go a long way. So you don't really have to force a connection by any means, but just when you're in the certain environment, working hard, letting them know that, hey, this is what I want to do. And a lot of people are willing to help you. And so I think that's how you get your connections now. How to get shadowing hours is a lot harder now, I feel like, than it was before, because back then there was a lot more private practices out there. Now there's large groups that are gobbling up all these private practices, such as like Optum and Molina and all these other places. And so they have kind of more stringent, a more stringent process on how to allow people to shadow. So oftentimes it's not in our hands as providers, but in the hands of, a larger entity that allows or does not allow us to shadow. Because if it was up to me, I'd let people shadow me all the time. But unfortunately, I'm not my boss, and certain places won't let me allow or don't allow for shadowing. So it kind of makes it harder for people to get it. I think you just have to kind of cold call a lot of offices. That's kind of what I did. I just reached out to people, randomly called offices and said, hey, can I shadow you? And you can find it that way. Or you go to family members' appointments. Sometimes you never know, they might be seeing a PA this whole entire time. You had no idea they were seeing one for the last 10 years. And you say, hey, I'm a pre-PA student. Do you mind if I come and shadow you once or twice a month? And that would be a good way for you to get some extra hours.
Thank you, Sato. The next question is for you as well. With your interview with USC and Duke, which characteristics do you think showed your greatest strength? And did they also mention what it is they liked about you that got your acceptances?
I got rejected from USC, so I think they hated me. Clearly, I'm not a very good interviewee, because I got waitlisted at every single school that I applied to, or I got an interview for, I guess. And so what was my strength? I guess perseverance would be one. Just letting people know that when I went into my USC interview, I let them know that, hey, this is like my 5th interview cycle. And the following one, I said, hey, this is my 6th interview cycle. And you could see like kind of like the surprise on people's faces, because most people don't try 5 to 6 times to get into school. They're either accepted or they stop applying. And so I think that might have helped me a little bit to leave like a mark, something that they could remember me by, as like, oh, that guy's like the 5th time applicant or the 6th time applicant, whatever it was. And then what was the second part of the question? Sorry, I lost my train of thought.
Yeah, you answered both. Thank you.
Okay, cool. So
The next question is, do you know of any programs or PAs accepting shadowing opportunities? I'm in ER tech, but at my hospital, there aren't many PAs or PAs willing to allow shadowing. I'm having a hard time finding shadowing opportunities and was hoping applying this next term before my class prerequisites expire.
I think, well, in the emergency department, oftentimes there's PAs. And so hopefully you can go to the ER and find out who the PAs are. Other than that, a lot of the surgical subspecialties will have PAs that are first assist. And so hopefully there's a PA there. If you go to the hospital's website, usually there's an entire list of providers, and you can drop on a drop down menu. You can click on physician assistant or allied health professional or APP or whatever their category for us is now. Click on that and you get an entire laundry list of people. And then sometimes they have like email addresses or office contact information and things like that. And so you can try to shadow them, because oftentimes subspecialties have clinic days too, so you can shadow them in clinic.
Thank you, Sato. Our next question is saying, do you have any tips for the description of the experiences section in the CASPA?
I would say the more in depth, the better, describing exactly what you did and not just saying like, oh, I helped with EKGs, like, oh, I assisted with blah, blah, blah. The more in depth, the better.
I would say make it detailed, but also don't make it extremely wordy, because keep in mind, these people that are reading your applications are reading hundreds of applications, right? So for all you know, this is like the 50th application they read. And if you have this long-winded answer for, I did EKGs, then you might bore the person before they get to the end of it. And so I'd say, yes, keep it detailed, keep it concise though, get to the point, and don't sugarcoat it, right? Like if you're an ER tech and you did EKGs, like people that are reading it are also PAs most likely, or MDs or someone else, so they know what what an EKG entails. So you don't have to like go writing this whole entire thing about like, I put 12 leads on or however many leads, what is it, 10 leads on the person's body, right? It's like, yeah, no, we've looked at an EKG before, so you don't have to go into that detail, right? Just tell us what it is that you did, and try to be concise with it, so that you're not boring the person to death while they're trying to read their application.
Can you tell he works in the emergency room?
Yeah, I can tell. Our next question is for Monique. She's asking, what's your best advice on tackling PA school from didactic to clinical year?
Clinical year is fun. Didactic year, you're going to cry at least once a week, probably. You're going to have a lot of material. You're going to want to learn everything, and you're not going to be able to learn everything. But you're just going to have to learn that you can't learn everything. And then you're going to practice it in clinicals, and you're going to be like, wait, I actually do kind of know something. And then you're going to start your first job and realize that you don't actually know anything. You're going to keep learning every day. And that's just kind of how it goes.
I think the number one thing is with didactic here, just be open to different study methods. What you did in undergrad may not necessarily translate over to your didactic year. How I always tell people is that, I took a pathophysiology course at UCLA on like cardiovascular sciences, so basically cardiology. That was a 10-week course at UCLA, and I learned all that information plus a lot more in about 2 weeks of PA school. And so, when you're in PA school, everything is condensed. You're expected to know so much more. And so, what you did in undergrad, whether it was, taking notes or coming up with Quizlets and stuff like that, may not work as well as it did before, just because there's too much information to know. And so, be willing to try different kind of study tactics to see which one works for you, whether it's group study, whether it's self-study, whether it's study guides, whatever it is that works for you. try to figure that out early on, because it'll help you throughout didactic year, and it'll definitely help you during clinical year, because you still have exams during clinical year as well.
Thank you. The next question is, do you recommend getting certified on a healthcare career such as MA, CNA, or EMT?
I feel like right now it's kind of hard to get a job without having one of those certifications unless you like know somebody. So I would say if you can afford it, yes. But if you can't, then you can continue like volunteering and then kind of eventually make your way into one of those positions. Because a lot of times, like they'll do like on the job training and then sometimes even help pay for your certifications for like CNA or MA. So
I'm biased. I think everyone should get an EMT license. Hands-on experience is great. Being an ER tech, I think becoming an ER tech can sometimes be hard because a lot of places require you to be a EMT first. Or by EMT, I mean like a 911 transporter or like a interfacility transporter of sorts before you can become an ER tech. Some places are different, depending on the state that you want to go to or the city or hospital you work for. Some want you to have a phlebotomy license. And so there's a lot of money up front that you have to pay. And so if you can pay it, great. I think, it's a great experience. You get a lot of bedside, patient, you get to develop a patient rapport. You get to work on your bedside manner and things like that as an ER tech, things that you don't really get to do much as an ER scribe because all you do is write charts all day long. And so, yeah, if you can afford it, I would say 100% go for it because it's great experience and stuff that you won't get to do as much as a PA. If you can't, then I think like a uncertified MA, there are some uncertified MA positions out there. You just have to find them. That is a little harder to find at times.
Thank you. Our next question is from Monique. She's asking, can you talk more about your transition from PA school to finding a job and applying?
Okay, let's see. So for me, I came back from PA school, I think in June. And then it took about a month or so to like apply to get my license and actually get my state license and my DEA certification and kind of all that. I found that a lot of jobs didn't actually like even look at your job if you checked, no, you don't have an active PA license. So sometimes you do need to wait until that actual license comes in so that you can put your number in. But I would say there's a lot of job availability out there and there's a lot of people who are willing to hire new grads, but you also have to be kind of very picky and like choose what job to take, right? There's a lot of primary care jobs for sure. But then there's also a lot of like urgent care jobs that will have you as like the sole provider and like, don't do that. Don't do that to yourself as a new grad. So just, be careful, but there's a lot of job availability. If you know what specialty you want to apply for, it might take you a little bit longer because a lot of people don't really hire new grads into specialties unless you know somebody who knows somebody, but yeah.
Thank you. Our next question is from Anthony. He's asking, how would you recommend getting shadowing hours now post-COVID? How did you deal with the financial toll of PA school? I'm looking to stay in state to help with that, but if when going out of state, what are things you look for? Any tips for waitlisted applicants like me? Last question, would you recommend working during PA school, even maybe per diem jobs?
I do not recommend working during PA school. That's definitely number one. There's too much for you to do during PA school. Your sole purpose of going to PA school is to learn as much information as you can during a short amount of time. At the end of the day, there's people's lives and livelihoods that are in your hands. And so I don't take that very lightly. So I think you should be spending every ounce of energy trying to absorb as much knowledge as you can. You take out student loans to cover for your PA school, your tuition and your cost of living and everything like that. And so I would rely on that to help get you through the 2-3 year program, whichever one it is that you're doing. In terms of staying in state versus out of state, some out of state schools are cheaper than the schools that we have in California or, you know, in other states. So I would look into how much the schools cost. There's, you know, state schools that are a whole lot cheaper than the private universities. So I'd look into the state schools and see if you want to apply to those, and that might save you, you know, 10, 20, 30, $40,000 over, you know, a private school like Duke or something like that. There's a question on how to get shadowing hours. I think you just have to, you know, ask around, reach out to your favorite Instagram PA and see if they're willing to accept shadowing hours. And then I think there was one more question, but I don't remember what it was.
It was any tips for waitlisted applicants?
Oh, if you're waitlisted, apply or prepare for the next cycle as if you're going to be rejected. The biggest thing I see with waitlist applicants is that they don't prepare for the next cycle. Then they find out about, you know, 2 months before the cycle starts that they got rejected. And then they're trying to scramble to improve their application. But now you have 2 months to improve your application. In reality, you should have been spending the last 12 months applying or improving it. So my rule of thumb is that every time you apply to school, you should continuously improve your application, because the last thing you want to do is shoot yourself in the foot and not do anything for 10 months and then find out that the next cycle you're the exact same applicant that applied the year prior.
Thank you, Sato. The next question is from Elena. She's asking questions for both Lili and Sato. Would the both of you be open for shadowing? And for pre-PA applicants, how big of a role do extracurriculars play in your application?
So none of the places that I work at accept shadowing, unfortunately. And that's kind of what Sato was saying, that a lot of these places just won't. They're giant institutions, right? So they want maximum efficiency, and a student shadowing you is going to delay you.
Yeah, if it was up to me, I'd take a student shadow every single day I was there. But in reality, I think one of the harder things is, I mean, you know, even though I'm 4 years into being an ER urgent care PA, you know, I still have a lot to learn myself. And so I take my responsibility pretty seriously in terms of, you know, I do have lives at stake at times in the ER. And so last thing I want to do is, you know, put someone else's healthcare in detriment, you know, because I'm trying to allow a PA shadow me or a pre-PA shadow me. And so I think I need to get somewhere, you know, I need to be better first before I can comfortably allow people to shadow, so that I can share more knowledge and information to them, rather than kind of giving you like a rudimentary kind of, you know, a brief overview of what I do and, you know, what it is that goes through my brain with each patient encounter.
Thank you both. Our next question is from Jessica. She's asking, why did you choose PA?
That's so funny. I was watching a TikTok yesterday about how this question comes up all the time, because I feel like a lot of people see PA as like a backup choice to medical school, which in reality, like they're two different things, right? Like a medical school education and like a PA school education. Like, yeah, you guys learn the systems and stuff. Okay, sorry. To me, it was shorter schooling, and I was going to be able to practice a lot faster, and not necessarily less responsibility, but just wasn't going to be the responsibility of like the doctor, you know, like if I run a case by my supervising physician, like, hey, we're charting in this and we're putting in this chart. Hey, I ran a patient by my supervising physician and he agreed with the plan. Like we're both there together. So for me, it was definitely the schooling. I couldn't commit to the schooling and then having like one single specialty for the rest of my career.
Yeah, similar for me, like lateral mobility was pretty big. I knew that I wanted to do emergency medicine. I also didn't want to be 60, 65 years old doing emergency medicine still. And so if I went the MD-DO route, then I would either do emergency medicine, or I would end up doing urgent care, or maybe like, Doctors Without Borders or something like that would be another opportunity, which unfortunately we can't do as PA. So I guess that was one of the main things. The other reason was, oh my gosh, I just had a brain fart. No, I can't remember what I was going to say now. But yeah, I guess that's my main reason.
Thank you both. Our next question is from Kelly. She's asking, were there any additional steps you needed to take to start working in a state that you didn't go to school in? I guess in a more general sense, does the state you attend PA school in have an impact to job search post-grad and where you can practice?
No, go ahead, Lili.
No. Sorry, go ahead.
No, go for it. You're good.
So for me, I don't think it really affected it because I knew I was coming back home. The only thing is like I did all my clinical rotations in the East Coast, so I didn't have that that relationship with like any of the specialties that I would have wanted to do. For example, I did my plastic surgery rotation out there. I couldn't be like, hey, like, do you guys want to hire me for a job? Because I didn't want to stay out there to live. So the only thing was like coming back home and applying for your license. But whatever state you live in, you just have to apply to that state licensure. But once you take your like PANS, you're certified to kind of work anywhere. You just have to have a specific license for the state.
I remember what my other reason was for choosing PA. The other thing was just kind of being able to be a lifelong learner. So as an MDDO, you go through, your 4 years of medical school, and then you go through like an extensive 3, 4, however many year residency that you do, or a fellowship afterwards. Once you finish that, once you've learned what you have, you work on your own solo after that. You don't really get to pick someone's brain anymore because people expect you to know what you know, right? Sure, you can, consult people and pick their brain about that, but I feel like it's harder for fellow like ER doctors, like MDDOs, to consult each other about cases, because most of the time they're expected to know their stuff, right? Whereas as a PA, we get to tap into that wealth of knowledge that they have, and so day in and day out, I get to pick someone else's brain that has gone through 7 years of medical training, right? And on top of that, X amount of years of real life experience after that. And so I get to tweak how I practice medicine, almost on a daily basis, just based off of what they have taught me. And so that's kind of the biggest thing that drew me to PA in the first place. In terms of when needing to practice outside, so going to school in North Carolina, applying for a license in California, it was, it's a little bit of it's a little harder because this programs often can't help you because they're not knowledgeable on every single state's requirements. And so you're kind of on your own. Luckily for us at Duke, we have about 20 something California kids. And so all of us were pretty much doing it together. There were some PowerPoints that were passed along from previous students and stuff like that. And so it did make it a lot easier for us to apply for our license. In terms of job search, again, it's all about who you know rather than what you know. And so for me, getting my first job in emergency medicine coming back was a simple text message to my assistant director of the ER. And I told him, hey, I'm coming home. I'd like my job now. And that's how I got my first job.
Thank you both. Our next question is from Marla for Sato. How did you address your GPA in your application and interview?
So in my personal statement, I did bring it up. I didn't necessarily mention that I had a 2.67, but I did mention, what I learned from my experience and what I've done to change it, which was, taking classes, maintaining a high GPA. During the interview, I kind of did the same thing. I told them, my GPA was lower, but over the past, 5-6 years, I've consistently raised it, year after year to get to a point where I am now. And so I wasn't afraid to let them know that my GPA was bad. Often, I had one interview where that asked me what the weakest part of my application was, and I just told them it was my GPA. My GPA is terrible. And I didn't make any excuses for it. And so you just have to tell them how it is, right? I did a terrible job in undergrad, and I've been paying the price since, and I've been trying to improve it every single year. That's all you can do at that point.
Thank you. The next question is from Danae. She's asking, how is it like taking the board exam?
It's terribly long.
So yeah, it's long, but if you have like a good program, you know, they'll train you and kind of condition you enough for it. It's basically like training to run like a 10K or a marathon, right? You're constantly like doing timed exams like in PA school. So you kind of have to build up this like stamina to do test taking. And I think they break it down into like 5 sections of 60 questions, I believe. So it's like a 5-hour exam. And you can get like 10-minute breaks in between. Definitely take those breaks, you know, to refuel, drink water, go to the bathroom, and just give yourself a mental break and then get back into it.
It's definitely, sorry. All right. It's definitely a marathon for sure. It's 60 question, I think, blocks, and there's 5 of them, so it's 300 questions. You know, over the course of your PA program, though, you'll practice taking exams like this. So our program will give us like a minute a question, and you just do those tests over and over and over again. Even your like clinical year exams, the end of rotation exams, are set up the exact same way. And so you basically study as if you're taking the board the whole entire time you're in school. It was definitely very long. I think the first 60 question block, I spent all 60 minutes to make sure that I didn't make any mistakes. And then eventually exam fatigue kicks in. And I think I finished the rest of the exam in about 2 hours and 15 minutes or something like that. I was just like, I'm done with this. We're going to go through it. The good thing is that, you know, a lot of programs prepare you pretty well. The PANCE pass rate is very high in a lot of programs, talking about, you know, 93 to 98%, somewhere like that. So as long as you study, you know, study diligently, you break down the sections, you cover all the material that you need to cover, I don't think you'll have any trouble passing the exam.
Thank you both. Our next question is from Yipsira. She's asking, could you provide some insights into the average compensation typically associated with most PAC in California positions?
It totally depends on where you work, who you work for, what you do for your work. You know, there's places that pay you $45, $50 an hour, right? Even in California, it could vary widely depending on what city you live in California. There's places that'll pay you $50 an hour. There's places that'll pay you $60 an hour. There's places that'll pay you $140 an hour, right? So it's not necessarily what the profession itself will pay you. It depends on what it is that you're doing, what subspecialty you're within, and what city you live in.
Thank you. The next question is from Mariana. She's asking, do you know of any accredited online or hybrid PA programs?
Yale. I think that's the only one I know of.
I think that's the only one I know of too. I think Yale is the only hybrid program there is out there. There might be some new ones. There's a lot of new programs popping up everywhere. So I think you just have to go online to, I think, PAEA, and go through their drop-down menu on their schools and just do the research and figure out which schools are online or hybrid.
Thank you both. The next question is from Alondra. She's asking for Sato, I have a question regarding your path to PA. When along your path did you decide on doing a post-bac program? Would you recommend a post-bac for students with lower GPAs?
I kind of did like an unofficial on my own post-bac. So basically every class I took after I graduated with my bachelor's, I just considered it to be a post-bac. I know there's programs out there in LA at Charles Drew or whatever that school is in Whittier that do like official post-bac programs. I do recommend people with lower GPAs to do a postbac to raise their GPA, or like their own postbac, whatever it is. Also, low GPA is very subjective. I often hear people say that they have a low GPA and they have a 3.3, which is like an average GPA that gets into PA school. So anything below that 3, I would definitely recommend, whether it's an official postbac program or you take a bunch of classes at community college, one of the local state colleges. I recommend you boosting that GPA above a 3 and as close to a 3.3, 3.4 as you can.
Thank you. The next question is from Ariana, and she's asking, this question is for both speakers. Do either of you know of any accredited PA programs?
Any accredited PA programs? I don't. And like, as in, like accredited or non-accredited?
She's asking accredited.
Because every program is accredited by ARC-PA, unless they've lost their accreditation. And I know Cal State Monterey Bay, I believe, just shut down because they lost their accreditation. So I think pretty much every school that you should be able to apply to will be accredited, on probation, or on provisional accreditation. That's something that you just have to go on to PAEA's website and then to take a look and see which ones fit your criteria, whatever stats that you have.
Thank you. The next question is from Jessica. She's asking, how does your daily work and lifestyle compare to that of other specialties?
Well, I feel like Sato mentioned earlier, like you really make your own work-life balance. As you can see, he still has the crackhead energy, working so many hours a month. But I really try to keep it at a minimum as much as I can, especially because the emergency room has like such crazy hours, right? So you have to do overnights, you have to do either like super early shifts or like the mid shift, which is like from 2 to 12. So I try to do like no more than 14 shifts a month, because I know that if I do 14, like I'm just too tired to really go out on my days off. So I try to keep work at work, which is the nice thing about working in emergency medicine and urgent care, is that, you know, you're there, you do your work, and then you're done. You don't have to worry about anything at home. So those are the two nice parts, that like work is work and then home is home. Like I forgot about medicine.
Yeah, I think you know, the beauty of urgent care emergency medicine is that it's shift work. So like Lily says, you know, once I clock out, I'm done. No one calls me, no one asks me questions, there's no patients reaching out to me. I don't have a message box full of, you know, labs to go over or messages to respond to. And so I can only tell you what I know because I've only worked in emergency and urgent care. But you know, although I work 16 days, I often either front load or back load my shifts whenever I need to go on vacation. And so that's kind of the nice thing about what we do, is that we can go on vacation whenever you want. Like I'll, you know, work my 16 days in the first 24 days of the month, take a 2-week vacation and come back and then work the last, you know, the next 16 days worth at the tail end of the month. And I won't ever have to use a single hour of paid time off. So when it's ready to cash in my paid time off, I have hundreds of hours just sitting there. So it's basically an extra free bonus. But how I determine how many days I work is I figure out how much money I want to make for the year. And then I basically just do the reverse math. And I try to figure out how much I can make and what would be most comfortable for me. And so, yeah, that's how I've decided to make my schedule.
Thank you both. The next question is from Jen. She's asking, what has surprised you about the PA career from what you thought it would be?
I don't think I have much of a surprise. I mean, I spent 6 years trying to become a PA. You know, I guess actually, you know, there were times when I thought you'd get looked down more by attendings. And you know, there are definitely some physicians out there that look down on PAs, you know, lumping us all together as unqualified and untrustworthy. There's definitely scenarios where that has happened, where physicians are like, let me speak to your attending. And I'm like, you can go ahead and speak to them. They don't know anything about the patient, but by all means, if you want them to read the note that I just wrote, then you can talk to them. And so, that has happened, but I say that's few and far between. For the most part, if you work hard, you continue to improve, you show eagerness to become better at your craft, then you're most often or most likely to be very well respected amongst your physician colleagues.
Thank you, Sato. The next question is from Jessica. She's asking, did you seek help writing your personal statement after being rejected?
I rewrote my personal statement every single year. And so I was very fortunate to have a lot of mentors that would help me. I'm a very poor essay writer to begin with. There's a reason why I do very poorly on the SATs and the GREs and the English portion is because my vocabulary is very limited and I can't write to save my life. And so I needed people to help me out. I know there's definitely schools, I think at UCLA, there was a writing center. And so you could reach out to your university's career center to see if they have something like that. Other than that, there are paid for services out there that charge you anywhere between $50 and several $100s to help write your personal statement. Although I would keep in mind that, oftentimes these people aren't by any means, I guess they don't have the credentials to know what exactly it is that, schools are looking for, since they themselves don't actually sit on any kind of board. So I'd keep that in mind if you're willing to pay for services.
Thank you. This is our last question for the night from Maruko. She's asking, how was your experience working at your first PA job as a new postgrad? Any specific challenges or good lessons learned?
I was in over my head. I had absolutely no idea what I was doing half the time. I worked in a very busy 54-bed ER that I was there probably 2, 3, 4 hours after my shift every single time. I was probably seeing more patients there than I am seeing now. It was definitely eye-opening. There's a lot of stuff that even now dermatology is not my strong suit, and it probably will never be my strong suit, but there's plenty of times where I'd look at a rash and I'd be like, I have absolutely no idea what this is. Or I'd see like, you look and have someone open up their mouth and you look in their mouth, you're like, I have absolutely no idea what's going on in your mouth, right? Happens to a lesser degree now, because with the years of experience, you learn a lot more. And like I said before, you get the privilege of having a physician beside you, right? So there's plenty of times when I pestered my attendings to be like, hey, can you tell me what this rash is? And the ER physician is probably not the best person to ask what a rash is either, because they're like, I don't know, it's a non-specific rash. And then so, but there's definitely people out there that are very good at teaching you, and they're willing to help kind of use different resources to try to figure out what it is. And so I think my biggest challenge was kind of feeling like I didn't know anything, but in reality, you do retain a lot of information from PA school. And so I would trust your instinct and your gut and just go with it.
Yeah, I agree. I feel like my very technically first job as a PA was in plastics. And as I mentioned, that was absolutely terrible. So then I went just like, I guess like a more straightforward way, which was pediatrics. And it was like straightforward and honestly kind of boring. So, but there was there was no supervising physician there, unfortunately. So there was like a senior PA who was in the clinic with me. So when there was stuff that I didn't know, like I would kind of run it by him, like, hey, what does this look like? Or, what do you think of this? But I would say like, don't, especially as like a very first like new grad, I probably would not take a job again if there was like no supervising doc there, because that's the time where you're going to be learning the most. And it's the time where you're fresh out of PA school and everything's still fresh, so everything is new, right? Like prescribing your first medication, you're like, oh my god, like am I doing it right? Did I prescribe the right dose, the right days? so it wasn't until I went to like the urgent care that really felt like a first like real actual job, because we had like a supervising doc. So I'd be like, hey, like this old lady's here with chest pain. Like the only thing we have here is an EKG. Like they got to go to the ED, right? And they'd be like, yeah, they need like a full workup. So the doctors obviously, have so much experience and they know a lot more than I ever will. So having them by my side is like perfect. I love it.
Danae?
Yes, can you hear me?
Yes. Can we go on to the next slide then? Oh, wait. That was the last question, is that right?
Yes, last question.
So we're going to go ahead and thank you, Lili, and thank you, Sato, for sharing all you've shared. If you're ever lucky enough to see them in person, they are great people to speak with. So we do have some upcoming events. We're hoping that your schedules allow for like a quick physical visit to in-person events we'll have in the future, hopefully so. And again, for the people that end up filling out the post-event survey, you will be getting their email addresses if you want to contact them and begin building some sort of mentor-mentee relationship. They're also just great people to ask general questions about medicine and definitely about the PA path. So we thank you again for spending time with us tonight. And we have a few more announcements. So if you want to stick around, that'd be great. And some surprise announcements at the very end as well. So thank you, Lili and Sato, once again.
Yeah, thanks for having us.
Thank you, guys.
Is this my slide, Danae?
No, it's Tabitha. I think she's on. Yeah, Tabitha, can you hear me?
Hello, yes, I'm here.
Okay.
Hello, did we speak about the app already?
No, we know you got kicked off. So
Okay,
we
yeah,
have
sorry.
this one.
Yeah, so if you guys are interested, we have an app where you can stay up to date with pre-PA events, and also get in contact with PAs. That's actually how I got one of my shadowing opportunities in Gardena. So really good place. If you can join through the groups app, we have a pre-PA student network specific group. And if you can go to the next slide. And then we also have an Instagram. It's @MiMentor. And if you want to stay up to date with any pre-PA committee initiative programs that we're having in the future that we'll discuss in a few minutes, that's the best place to keep up to date with that. And then also learn about other opportunities within the MiMentor organization. Next, please.
That is me. So as we mentioned at the very beginning, Mi Mentor does not charge for any of these resources. So we like to champion other organizations that also don't charge. Someone brought up the question about paying for professional professional review of personal statements. And we think that if you work just a little harder to make those personal connections with PA students and PA providers, you will see what a wealth of resources they can be, not just for your personal statement writing, but for really walking alongside your path into PA school. So to say the least, we have connections and relationships with the Charles Lee University PA program pipeline, as well as the USC PA pathways, the Marshall B. Ketchum Pre-PA Mentorship Club. We also know of PAs that run this organization called the Vida Mobile Clinic out of the San Fernando Valley, and they have a pretty cool pre-health program that is quite competitive, but also very rewarding. There's also the Tena Health organization that offers a lot of volunteering and pre-health extracurricular hours, in essence, as well as a new organization that got formed by 3 PA students out of USC called the PA Peers. Check them out. They have great stuff going on. And right now, between now and CASPA opening it at the end of April, they have a lot of things going on. So we're always trying to like support what they're doing. So go ahead and check them out.
Yeah, with that being said, we have very exciting upcoming events in the next 2 months. One of them is we're having a virtual personal statement review with amazing PAs that will take place in March 13 at 6:30 p.m. And then we have two very important in-person conferences that I will go further into the next couple of slides. Next slide, please. So for the pre-PA strategies personal statement review, we'll be only accepting 20 pre-PAs for this session. So there's going to be one session in March and then the other session sometime in April. And with this, we're looking to pre-PA students who are reapplicants and those who are first-time applicants considering to apply this upcoming cycle, the 2024 and 2025. And how will this look like? We'll have two PAs who will introduce themselves and advice on how to tackle a personal statement. And then after that, there will be a breakout rooms with the PA. Each will be assigned with 4 pre-PA students that will be going over their personal statement drafts. And that this is all virtual and taking March 13th. Next slide, please. And here's this QR code where you can find more information about the personal statement review. So you can go ahead and scan it to Google interest form. That way you can fill out the information. There's more details about that as well. So we'll just take a couple seconds here. If you want to take a screenshot.
If I may add something, so we're encouraging, as Danae said, the reapplicants and applicants for the 2024 cycle to submit. We do hope that you have some sort of draft. If not, this is happening 3 weeks from now, so it gives you, 3 weeks to jot some stuff down and have it ready for when this session begins. So make sure you get writing. It's just about the perfect time right now.
Thank you, Sarah. And we can go to the next slide. And so we're bringing to you an in-person conference as part of a partnership between Mi Mentor, USC Pathways, and the USC Pre-Health Advising. And for this is taking place at the City of Commerce at 8:30 in the morning to 1:30 in the afternoon. And this is going to be on a Saturday, April 6th. This is also towards those students who are reapplicants and first-time applicants for the 2024 to 2025 cycle. And we have so many great activities that will be taking place that day, from keynote speakers to the admission panel, networking session, and along with different workshops from suturing, splinting, and clinical Spanish. So stay tuned for more details. This is the QR code where you find more information about the conference. Make sure you'll take a screenshot of this as well. And then lastly, we have another pre-PA conference that is also taking place in person. This will be the following week after, so this is April 13th. This is at the USC campus in the the city of Alhambra. And this is for those who are reapplying to the following cycle. So the 2025 cycle and forward. And those who are more curious about the PA profession, this is a good spot. This is a good place to get to know more about what a PA does. I think you guys got a little bit insight from Lili and Sato. And if you want to get to know more information about that, you could also email the USC PA pipeline at usc.edu for more information. And then you could also take a screenshot or scan the QR code. We can go to the next slide.
Alrighty, so these are our current pre-PA committee members. If anyone is interested in potential leadership experience and opportunities, you can email us at any of these emails if you'd like to join and plan on applying to the upcoming cycle. Next slide, please. And then please make sure to fill out our post-event survey. It's a great way for us to know and learn more about you, and then also on how we can improve on some of our events. So if you can please take a scan of that.
Remember, this gets you Lili and Sato's email address. And there's one more slide, correct?
Yeah.
Is that me?
Yeah. Oh, I can do it. But as a thank you for everyone who stayed, I know it's getting late, but as a thank you, we are offering 2 hours of extracurricular time that you can actually apply to your CASPA application. you just have to complete the registration that you did to get the link. And then also we have to confirm your attendance. And then if you can please fill out the post-event survey and then email us tonight, please, at prepa@mimentor.org. And thank you everyone so much for your
Thank you all who stuck around. Have a great night. Oh, wait, somebody's asking, is there a potential pre-PA conference that could be happening in North California? You can make it happen. We're actually looking for folks that are either in Central California or Northern California, where Mi Mentor has an infrastructure, but has primarily pre-med students. So we know that the the pre-PA students are around. They're just kind of scattered. We're more than happy to help build a committee in Central California and Northern California, especially because we have connections with Stanford people, with Samuel Merritt, with UC Davis, with Toro. So we need more. Yes, Araceli, thank you for the encouragement. Email us, because if you email us, we can get in touch. As Tabitha just mentioned, we are more than happy to help build leadership. And you have no idea the reach that being organized as pre-PAs is getting us. We actually just, I guess, insider info, we just met with the UC San Diego PA program because they wanted to know more about us. We are meeting with the Stanford PA program tomorrow because they want to know more about what we're doing. So in and of itself, we are connecting with a lot of programs, connecting with a bunch of PAs. All of the PAs that have come through the PA programming events are like our mentors, our personal connections. And these are like built through the years. And they can be your mentors as well. So build it up. Somebody's asking, what about bonus for those who have attended our oh, I'm sorry. I mentioned that, right, Danae? I did. Is that what you're saying?
Yeah.
Okay, sorry. Leadership roles, I mentioned about leadership roles. Mi Mentor is going to open up positions for what we call like entry roles that are called pre-PA ambassadors. So in essence, you would start as an ambassador, and when you have a committee form, then we begin to form people that take care of media for pre-PA stuff, people that take care of outreach, pipeline programs, you know, the president positions or whatever. But we first need to build a committee that would have that commitment, that interest, and the drive to run programming for a whole year. And Mi Mentor is huge. We're national, but the strength of the organization is in Southern California, and it doesn't have to be Southern California only. So again, stick around for that. And if you have questions, great. Melanie's asking, where can we reach out for the pre-PA ambassador? Email us. Go ahead, email us at prepa@mimentor.org. Tell us who you are, where you're from, where you're located, if you have connections with anyone. Stephanie's asking, maybe in the near future, Mi Mentor can expand into the East Coast. We have people somewhere in the East Coast, but they're pre-med students. And there's also North Carolina people, and I believe Chicago. But again, the pre-PA initiative is a new thing in Mi Mentor, even though we've been doing pre-PA stuff in the last 5 years. But as an initiative, it's pretty fresh. But we're blooming and we're having a great time, so we can keep it going. Again, reach out to us. It doesn't help to also just get involved with Mi Mentor in general to see how you can learn the ropes of the organization, and little by little you begin recruiting, and we can always provide infrastructure and guidance. It's a pretty well organized, well-oiled machine, let me tell you. Anyway, does anyone else have any other questions? And of course, we like to make sure that like you have all these extra perks. So for those of you that are attending the conference in Commerce, it's going to be amazing because nobody else is organizing conferences outside of their institutions. We know MBKU has an open house, but you only get to hear MBKU, right? So we want to have many schools attend, and that's exactly what we're trying to do. And more than anything, we want to make sure that you have one-on-one time with pre-PAs. I'm sorry, with the pre-PAs have one-on-one time with PAs and PA graduate students, which we find to be the most valuable because they've been through it. But also to like begin building alliances with people here. I know people from as far as Oxnard are planning to come down to the conference in Commerce, and people in Riverside. I mean, we have UC San Diego coming up. So get excited because it's gonna be great. And if you have input, let us know. So without further ado, I think we're gonna call it a day. Please fill out the surveys, and we hope that some of you join us March 13 for the personal statement review session 1. If you don't make the cut, we'll have you set to the April one, late April. Most definitely check out the conferences April 6th and April 13th, and we'll be in touch with more virtual stuff. So you all have a good night.
Thank you, everyone.
Have a good night.
Thank you.
You're muted, Sarah.
I'm talking to my child.
Oh.
She's like, can I come and see? Can we stop the recording? Who was recording? That's like